Hi, we're here at Beth Winkler's home, and she's going to share her special story about her little girl, Anneliese. Anneliese is battling a rare form of cancer that hits mostly children. It's also known as RMS, and we're going to learn about how they're going through the illness, the treatment, their faith, and how their family and friends are helping to support Anneliese, and how Anneliese is just a fighter and really giving inspiration to other kids and other families that are dealing with this ordeal as well. Great, so if you could tell us about you and your family and a little bit about Anneliese, that would be great.
Yep. So our family has me and my husband Josh. Our daughter Emma just turned 9. Anneliese just turned 5, and Zoe just turned 3. Let's see, a little bit about us. Anneliese is the feisty one. Emma is the bookworm, and Zoe is 3. She's exactly what you would expect from a 3-year-old.
And she messes up things.
And she messes up things a lot, yeah, that's true.
Okay. So, what do you think makes, I guess, Anneliese special in terms of, how she's dealing with her illness and how even just everyday life, how she relates to you, her family and friends?
You can answer. What did you want to say?
Nothing.
Nothing. You changed your mind. So we kind of joke that if there was ever a kid who could beat cancer, it's her, because she was basically born fighting, and she's been fighting me every day since. But she is just a very, very resilient kid. And even though I think, obviously, especially in the beginning, the whole diagnostic process is very difficult, and there's a lot of scary things and a lot of unknowns. And she just plows through it like a champ. And when it's all done, she's just over it. Kids have this resiliency that I think a lot of adults don't even have, because they just sort of take it and they're like, well, this stinks, but we're going to get through it. And then what are we going to do when you're all done?
Go to Disney World.
Oh, go to Disney World. So can you describe Anneliese's cancer? Because it has a pretty long name. Yeah. I know the common term is RMS, but how do you pronounce the term?
So her official diagnosis is embryonal rhabdomyosarcoma, which is a soft tissue tumor. It's not in the bone or anything like that. And hers actually arose from embryonic stem cells that undergo a series of mutations and then develop into cancer. And Anneliese's is sort of located in this area over here.
That tickled.
Sorry.
How do you say it one more time?
Embryonal rhabdomyosarcoma.
So how did you guys find out about the illness?
She woke up on a Saturday night and she said her ear hurt. And I gave her some Tylenol, and we just figured maybe she was getting a little ear infection. On Sunday, she came up to me and she was crying. So I looked at her ear and I could see something in the ear canal. So I took her to the emergency room, and he said, no, it's fine. You should just follow up with her pediatrician. It's no big deal. But I told my husband, I said, I really think there's something in there, and I think they're going to have to pull it out. I thought she had shoved like a little bead in her ear. I know, wasn't that silly? So her pediatrician took a look at it the next day and saw what she thought was just an ear infection. So she started a course of antibiotics. 5 days later, the pain was getting worse, and the appearance of the ear itself was getting worse. I could see that there was something very wrong. So she referred us to an ear, nose, and throat doctor, who referred us to a second ear, nose, and throat doctor, who referred us to a third ear, nose, and throat doctor. And before we could meet with the third one, we were at church, and she ran up to me to tell me something, and I noticed that the right side of her face had completely stopped moving.
Oh. Wow.
So we called her pediatrician, who alerted the Yale Pediatric Emergency Department that we were on our way. And she was admitted. When we got there, the next day, a surgeon came in and performed a biopsy, and that afternoon we found out it was cancer.
Oh, wow. So from that diagnosis on, like, how long have you guys been, been battling this?
We just hit 4 months. She was diagnosed on February 7th.
Okay.
So we're 4 months in.
Can I leave?
Anneliese, is it, how are you doing through all of this? Is it hard, or, can you tell me a little bit about what you have to go through?
What do we do to take care of your bump? What are some of the things we do to get rid of your bump?
I don't know.
Yes, you do. What do
No, I don't.
What do you have to take?
Medicine.
Do you like taking medicine?
No.
No.
I don't like to keep.
No, she does not like taking medicine. And what do you have here?
Port.
A port. And what's your port for?
Medicine.
That's for your really special medicine. During our first hospitalization, she had surgery to put in what's called a portacath, and that's what they use to access her bloodstream for chemotherapy every week. Do you remember anything else that we've been doing to get rid of your bump? Do you remember when you had to wear the mask?
Mm-hmm. Hey, it was so tight. I didn't like it. Nope, I didn't like it.
Nope, she didn't
Don't
like
even say it!
She went through 6 weeks of radiation in addition to the chemotherapy. And she would lay on a table, and this big mask would go over her head, and it would bolt into the table so that she couldn't move her head at all. And then she would kind of go under the machine, which rotated around, and the bed would rotate around, and so they could get your bump from every different angle in your head. Right? And you handled it like a champ.
Yeah, your mom says that you met some people and you're helping other people too. I guess that was, why your Twitter name is Mighty Anneliese, right?
What did you tell Miss Kim about?
Port.
Yeah, we have a grown-up friend who had to start chemo recently and get a port, and so Anneliese was able to tell her all about it, and
What are
she
you
told
pointing
her.
at?
Oh, you want to show them my bracelet?
Mm-hmm.
These are bracelets that Annaliese's grandfather purchased, and on one side they say Anneliese Rinker, and on the other side they say cancer free. And it's just a reminder to friends and family every time they look at it to just say a quick prayer that she will be cancer free.
That's wonderful.
I'm not cancer free. He knows.
You're very silly today.
Well, what is her current treatment? What is each day like?
In the beginning, we would go for radiation 5 days a week. That is done. So now we go to chemo clinic every Monday. We go in, they access her port, which is a needle, and she gets one particular type of medication every single Monday. Every third Monday, we are admitted to the hospital, and then she gets 2 additional chemotherapy drugs every third week. And that pattern repeats itself for a total of 43 weeks.
So you're how many in the
We
week?
just got week 16's treatment this Monday.
Yeah, as you learn about her cancer, are you surprised? We've been kind of doing some research, and it seems like it affects children mostly. Has she been, meeting other kids with the same thing? Does it help you to know that there are other kids and families out there going through the same thing?
Yes, rhabdomyosarcoma is one of the rarest forms of cancer. When it occurs, it almost always occurs in children. But on our clinic days, we've actually been able to meet one little boy who was just finishing up his treatment with a rhabdomyosarcoma diagnosis, another little girl who's just starting, and sort of people at every phase of treatment. And there's definitely
A lot of people.
there's definitely a lot of people. There's almost an instant bond, I think, with other parents because
Bond.
You just-
No bonds.
there's no bonds at all. Because you just can't really understand everything it entails unless you've been there.